I'm Rue the BOOBS, and today we're talking about nipple pain. All right, so let's talk about some of the things that, some of the products that Haakaa has that can help you along your journey, especially when it comes to nipple pain, preventing nipple pain, and helping your baby get that deep latch. Now remember, in order for baby to get really nice far and back there, you want to make sure that your nipple is protruding. Sometimes you need to do a little bit of reverse pressure, right? Where you're just pushing back the areola so that that nipple can stick out. You're going to do this for about 45 to 60 minutes. Right? And you're going to rotate your fingers as you do that right before baby latches. If you're super engorged, sometimes you do need to move some of that milk out, because as long as you're engorged, that areola and that nipple is going to be really taut, making it hard for baby to even latch on, making it hard for you to get that nice big hamburger latch, because what you want to do is give baby a nice big area to latch on. But they're not going to be able to come all the way back here if everything is pulled back and really tight and taut. So this is where the Haakaa pump, the Haakaa manual pump, can be super, super handy. And so you can put the Haakaa pump on about 5 minutes before it's time for you to breastfeed, especially when you're really engorged. Check out the video on how to put on the Haakaa pump. I'm going to give you a real quick tutorial. You want to go ahead and flip it, and then you're going to squeeze it. Okay. You're going to stuff it, and then you're going to flip it again, and then it will hold. So you want to keep it there for about 5 minutes. I usually tell my moms to get out about half an ounce to an ounce, just enough for you to get that nipple and areola area a little softer to make it easier for baby to latch. Okay, the next thing that you can use from Haakaa, this is going to be great for my moms with inverted nipples, dimpled nipples, flat nipples, right? If you want to try and pull those nipples out and just get those nipples to stick out a little bit more. All right, these are Haakaa's nipple correctors. And I just love the little carrying case, because a lot of times this is where you run into trouble. You're like, where did I put those things? So you've got a little carrying case. You do want to make sure that you wash these and dry them out nicely after using them. They're all Haakaa products are made out of medical grade silicone. So love, love, love them. It has got a dome right here. Depending on how much you depress the dome, that's going to determine how much pressure or how much suction you're going to have. So you can depress it a little bit. You can depress it all the way in. And so what you want to do is depress the dome and then put it over the nipple area. Okay. There we go. And it's just going to suck it all out. And just look at my skin there. And you can see it's pulling out my skin. And that's what you wanted to do to your nipple and your areola. Now, you want to make sure as you're doing this, as you can imagine, if you got nipple damage or nipple trauma, you do want to make sure that you're taking care of that, or you're at least working with somebody to heal that trauma, to heal that damage, because this is going to be really uncomfortable if you've got cracked, bleeding, fissured nipples. All right. So to wrap up, let's talk about the things no one tells you before you have a baby. And just a quick summary of nipple pain in general. All right. So what no one tells you: nipple pain in the beginning is normal. Again, like I said, your breasts have never been sucked on every hour and a half to 2 hours, 24 hours a day, nonstop, with something with immense suction. Now, you know, if you've used a breast pump, your baby's suction is stronger than a breast pump. So you've got a little piranha on your nipples. You're bound to have some damage as your nipples kind of get initiated into the breastfeeding process. So you're going to have a little bit of discomfort. Again, usually the first few days, about day 3, day 4, it peaks, and then it starts working its way down. By the end of the first week, going into the second week, most moms are like, you know what? I'm good to go. We're good. Second thing I want you to know: worsening, persisting nipple pain, not okay. You need to make sure that you're talking to an LC, you're talking to a medical provider, get the help that you need. It is not okay for you to continue to be in pain. It is not okay for the pain to be getting worse. It could be something related to how baby is latching, which an LC can help you with, or it could be something to do with baby's anatomy. They may have an oral restriction, which a good LC should be able to help you identify and kind of walk you down the path of getting that fixed and what that would look like for you guys. Okay. And then there are remedies. Number 3, there are remedies for flat nipples, dimpled nipples, inverted nipples. It is important that if your nipples, quote unquote, look anything other than the normal or a variation of anything that we normally see, right? Your textbook nipples where you've got the nipple sticking out, the areola. If your nipples look different, right, you want to make sure that you get a prenatal consult, because before you have a baby, we can probably help you figure out ways in which you can get a comfortable latch when baby comes. We can start working on pulling out inverted nipples. We can start working on shaping or molding flat nipples. We can help you learn how to put these on correctly, right, before you have a baby. And most importantly, you can order these ahead of time. And a lot of times, some of the things that we can do for like inverted or flat nipples, we can start doing right about 39-ish weeks with your OB's approval. So you want to make sure that you get your OB's blessing, because anytime you have nipple stimulation, you do run the risk of stirring up labor. So we want to make sure that your OB is okay, your OB is aware, and it's like all systems ahead. Let's just go ahead and do that. All right. Number 4, it is normal to feel like it is normal to not want to feed your baby. Okay. I think in my practice, I've got 3 boys, right? Boy mom. So my boys are 9, 5, and Gray, who's my baby, is 8 months now. And he had a really severe anterior tongue tie. And after having breastfed 3 babies, I breastfed my kids for about 3 years. So I'd been breastfed for about 3 years each. So I've been breastfeeding for the better part of, the last 9 years, really. And I remember with Gray, the pain was so intense that he would come to the breast and I would just look at him, and it was almost like this anger at him, right? I would look at him and I'm like, I don't want to do this. There was not a part of me that wanted to go through the pain that I was going through feeding him. We did get his tongue tie fixed at day 7, but I kid you not, guys, I literally was like, and I say this all the time because I see moms in our clinic, in our lactation clinic. And, I would always say to moms who are like, oh, I don't want to breastfeed. I feel like I don't want to breastfeed. And I'll be like, yeah, I know. I didn't know. I really, truly didn't know until that happened to me. And I realized that as a mom, as these thoughts are going through your head, I felt like a bad mom. Like I was like, what's wrong with me? There's nothing wrong with me. It's not normal to be in that pain. No one should want to be in consistent, incessant pain. Pain is a form of torture, right? So we know that it's not normal. I want you to know, if you're that mom who is sitting there going, oh my God, this is so painful, I don't feel like feeding your baby, that you're not alone. You're definitely not alone, that you shouldn't be in this much pain, that it is okay to actually get some nipple rest. So there'll be times when moms are like, it hurts so bad, I don't want to nurse my baby. And we can talk about a nursing pattern that allows you to get some nipple rest and get the nipple some time to heal. Skipping a feeding or 2 can completely revolutionize your breastfeeding journey when you're in a lot of nipple pain, when you're waiting for a tongue tie to be fixed, when you're waiting for that apno to kick in. Just in case you're wondering, usually within like 24 to 48 hours, when you start using apno and we fix the latch, then everything is starting to get better. So a lot of moms are like, oh my God, that feels so much better. And again, if we don't fix the latch, right? If we don't fix the cause of the nipple pain or the nipple trauma, then it's going to continue to happen, which is why it's so important, if it's persisting, that you see an LC, if it's a tongue tie and you want to breastfeed, that is something that we consider addressing so that you can have a pain-free breastfeeding experience. But I just wanted to talk to the moms that are out there that are like, you know what? I just felt like a bad mom, or I felt like a terrible mom, or the moms who stopped breastfeeding because it hurt. No, the nipple pain is real, and pain is so subjective. It is what you tell me it is. And my goal, and our goal as medical providers really should be trying to get you to a place where you can nurse comfortably. You can nurse and not be in pain. It is not okay for you to be in persistent, excruciating pain. That's just not okay. All right. Last but not least, get help. Get help. It's so important for you guys to have your LC, have somebody who can help you troubleshoot things whenever you guys do hit those bumpy roads. Get help sooner rather than later. A lot of times moms are coming to me again when you guys have got hamburger meat for nipples. And at that point in time, we are doing a lot of nipple rest. Yes, when you do nipple rest, you do run the risk, right, of using a bottle or using an artificial nipple. When you do that, you do run the risk of causing nipple confusion and baby not necessarily wanting to come back to the breast. But if we can get you early, enough, we can take care of the nipple pain, we can fix the latch, we can fix what's going on with baby's mouth, and we can prevent the baby from getting too many bottles within those first 4 to 6 weeks, which would then lead to nipple confusion and possibly breast refusal. All right, so that's what I have for you guys on nipple pain. Go ahead and put your questions in the comments. I will be checking them and responding back to you. Don't forget to hit the subscribe button and don't forget to hit the alert button so that you know when we've got a new video up. All right, mamas, it has been real. I hope you learned a lot about nipple pain and I hope to see you guys soon. Bye.